American Cancer Society, breast cancer is the most common cancer type among American women. The second leading cause of deaths due to cancer in the U.S., only coming in second to lung cancer. The risk factors for getting breast cancer is A, just being a woman, B, age. With increase of age, you have increase of risk of breast cancer. No live births. Cancer gene, a mutated cancer gene also increases your risk of breast cancer. And also having a first-degree relative with breast cancer, a mother, sister, or daughter. Family members with the first-degree relative having a breast cancer should start having their mammogram screenings 10 years prior to the relative being diagnosed with breast cancer. Mammography is an excellent tool for detection of breast cancer. Mammography is a low-dose X-ray of the breast that can detect changes in the breast tissue. It can see stuff that we can't feel even when we're doing our clinical breast exams or our self-breast exams. There's two types of mammography units. There is a film screen and there's digital. Film screen is what we use here at Launchville, and it is the most commonly used and the most readily available and easy to work with. This is a mammography unit. It has the ability to capture small details in the breast and to give you information that you wouldn't normally be able to see in a regular X-ray or CT or an MRI or even an ultrasound. So mammography is dedicated to breast. It has a faster processing time. It takes about 90 seconds for each film to process after we have taken a film of your breast. And also, it is a fairly non-expensive unit compared to other digital units. Like I said, this is the mammography unit. It comes equipped with a compression paddle, and what the compression paddle is used for is to flatten the breast to make everything on an even playing field, because cancers can hide in different tissue areas, and in your breast you have thick tissues, and you have thinner tissues, and you have fat, and then you have breast tissue. Breast tissue, if the cancers are hiding in there, then we take and we smash your breast down completely, and that evens everything out so we can see cancers or calcifications hiding in your breast. Discomfort from compression, there's a lot of patients that complain about discomfort. It is necessary for us to get a diagnostic image to use a certain amount of compression, and we have a lot of patients that complain about discomfort. One of the ways that you can kind of offset maybe the discomfort a little bit is by not drinking any caffeine a couple weeks prior or even a week prior to your mammogram, and then also trying to schedule your mammogram around your cycle. Maybe schedule it a week after your cycle, never a week before, maybe 2 weeks before your cycle, then you'll be okay, but never like the week before the week of your cycle. We do several types of mammography. There's the routine, which is for your women that are 40 and older, and they're safe to do those yearly. And then there's a diagnostic. A routine, you're going to get 4 images, 2 of each breast, a cranial-caudal view, so from your head to your toes, cranial-caudal, and then an MLO, which is a medial-lateral oblique view of your breast. 2 on the left and 2 on the right. So 1 cc on the left, 1 MLO on the left, 1 cc on the right, 1 MLO on the right. The cranial-caudal, to make it a diagnostic image, your nipple needs to be directly in the middle of the film, and it includes your whole breast, looking like down at your feet. The medial lateral, the MLO view of your breast, is axillary, so you would put your armpit on the cassette and then we would squeeze in this direction. There's also other views that we can do if you're a diagnostic. So a diagnostic person is someone who either A, has a lump that they know of, or B, has nipple discharge or some kind of history that warrants you to come in and have a special mammogram. With a diagnostic, you can have an ultrasound, you can be recommended for MRI. But a diagnostic, you're going to get what's called spot compressions, and we use a smaller compression paddle for diagnostic mammograms. So we go in and we target one area or 2 areas or multiple areas of your breast, but we use smaller compression paddles to even them out. to even them out better, so because they can't get the densities evened out with this compression paddle. Also with the spot films, you can do mag views, which is mag stand. So you would use a taller stand and it would make everything come, it's like looking at your mammogram through a magnifying glass. That's also something that we would do with diagnostics. Here at Launch Tool, we do diagnostics in the afternoon. They're a 30-minute slot. You come in, you have your mammogram done, and then you will either, like I said, go to ultrasound or further, and then you will leave with your results. So to conclude my speech, the progress that we've made today in breast cancer detection through mammography and the treatment that we have done and have found, it's made the mortality rate of breast cancer less. It's decreased by 20%. So if you need your screening mammogram, don't be afraid to call, schedule an appointment, get in there. If you don't know your family history, find your family history out so you can have your mammogram